Hey everybody, Dr. Mehta here. Today we're going to be talking about septoplasties. As most of you know, I specialize in rhinoplasty, so nasal surgery is a huge part of my practice, and many patients that have a rhinoplasty also need a septoplasty for a deviated septum. So I thought this would be an interesting topic to go into just because we often hear about deviated septums, but we might not understand exactly what that means. So a septoplasty basically means a procedure to correct a deviated septum. So the septum is this top part of the nose. I'll show you some slides coming up that go through the anatomy of the nose in a little more detail. Basically, a septoplasty can be done as a standalone procedure, and in that case, it can be done open or closed, which is an endonasal approach. And most septoplasties, especially if they're really simple septoplasties, are done closed, meaning just working through the nostrils. And these are septoplasties typically performed by an ENT, an ear, nose, and throat surgeon, or in my case, I'm double boarded in ENT and in facial plastic surgery. So a septoplasty can be combined with other procedures. So this might be a repair of the internal and the external valves, a turbinate reduction. It may be a perforated septum repair. So perforated septums can happen from cocaine use, from trauma, from prior surgery, from nasal spray use, those kinds of things. And they can also be, the septoplasty can often be done in conjunction with endoscopic sinus surgery. So endoscopic sinus surgery is surgery that's done to open up the openings to the sinuses as they drain into the nose. So those are the cheek sinuses, the sinuses between the eyes, and the forehead sinuses. And then in my practice, I often combine septoplasties with the rhinoplasty. Occasionally I'll have patients that only need a deviated septum fixed. But most of the time when I do a septoplasty, I'm also doing a rhinoplasty along with it. So the nasal septum is the wall that divides the nose into a left side and a right side. So we want that wall to be right down the middle of the nose so that you have an equal airway on the two sides. This is made up of cartilage here in the front and bone at the back. This is the side view of the nose. So the top of the septum here is what makes up the top part of the bridge. So when a patients have a hump, usually that hump is made up half of cartilage and half of bone. So when it's shaved down, then you end up with this type of a shape. So this is the top of the septum here, and here you can see the front of the septum. So the front of the septum is the support for the tip. So you can see how the front of the septum here is sitting in this little notch. That's what we call the nasal spine. So we want that septum to be right in the middle. When the septum is off to one side or the other, then that can cause the nostrils to be different shapes or the tip to be crooked. And then, as we talked about, this is what we call the perpendicular plate of the ethmoid. This is the vomer. This is the quadrangular cartilage, and here's the nasal spine. Just to give you a little more orientation, this is the brain up here. This is the mouth. These are the lips. So this is the front, and this is the back, basically. Now, what is a deviated septum? So a deviated septum, let's pretend that this is your septum here. So this is the front, this is the back. So this is what we call the L strut. So the L strut basically means that the top of the septum here and the front of the septum here, those are kind of the sacred parts of the septum. So we need that support, and this needs to be at least 1 centimeter here at the top and 1 centimeter here at the front. So if this part of the septum is crooked, which is the middle and the back of the septum, then it's a very straightforward procedure. Then what I do is I'll typically cut out the crooked parts of the septum, and that's partially cartilage and partially bone, and then you end up with what we call the L strut intact. So I'm here, I'm removing the crooked middle and back of the septum, and then I'm leaving behind the top part of the septum and the front part of the septum. So that's running down the middle like this. Now, if the top and the front are crooked, so in some cases, if the top of the septum is just a little deviated to the left or the right, straightening the nasal bones will actually cause the septum to shift over. If there's still a little bit of a deviation of the top of the septum, then I often will take a graft of cartilage here and I'll place it along the top of the septum. That's what we call a spreader graft. So that's a way to widen the valves of the nose and also make the nose look straighter at the same time. So that's made up of the cartilage from your septum. If somebody's had a prior septoplasty, so some of this cartilage is already missing, then that's when we start thinking about ear or rib cartilage in order to make the grafts. And there are some cases in which the front of the septum is super twisted or deviated. I'll talk about that in a future talk. So that's a more aggressive septoplasty, is what we call an L-strut reconstruction or a repositioning. That goes a little bit beyond the scope of today's talk. I just wanted to go through kind of a simple septoplasty with you guys. So hopefully that kind of makes sense. The surgery is done under general anesthesia. A simple septoplasty, it's usually about 30 to 60 minutes, including the anesthesia and the setup time and that kind of thing. The basic steps, so first I numb up the nose with local anesthetic. That's lidocaine with epinephrine in it to reduce the bleeding and also to numb the nose, so that even if patients are under anesthesia, we don't want them to be sensing or feeling any pain. I elevate the mucoperichondrial flap, so think of the septum like a sandwich. So each side, there's a lining of the septum, and then the middle is made up of the bone and cartilage. So in a typical septoplasty, I'm lifting up the bread, removing the crooked meat or cheese that's inside the sandwich, and then I'm putting the bread back together again. So we don't want there to be a hole or a perforation in the septum. So essentially, we lift up the flaps, remove the part of the bone and the cartilage that's causing a blockage on one side or the other, stitch it back together again. And at the end of the surgery, I put in what are called Doyle splints. So these are these soft rubber tubes that stay in for typically 3 to 6 days after the surgery. These are nice because they allow you to breathe immediately following the surgery. I typically don't use any kind of packing at all inside the nose. And these soft rubber tubes, they slide out pretty easily. They do hurt for a second when you come in for the follow-up visit, but there's a nice relief once they're out. And I find that it's unnecessary to leave them in for more than 6 days for the vast majority of patients. In terms of pain, I'd say the pain after septoplasty is pretty typical to wisdom teeth. So you feel sore and uncomfortable, but you're up and around, and you're not laid up in bed the way you might be after an orthopedic surgery or an abdominal surgery. Most patients have light bleeding and generally return to work or school, usually when the stents come out. So that's anywhere from day 3 to 6. And you can exercise around 10 days after surgery. So these are the benefits of septoplasty. So why get a deviated septum fixed? The first thing is obviously improving your breathing. So having less resistance in the nose so that the two sides of the nose feel more equal. I find that often patients have a better sense of smell or taste. After the surgery, many of my patients will tell me that for the first time they can taste things in wine or food that they couldn't taste before and couldn't smell before, obviously. There can be an improvement in your voice quality. So often patients tell me that their voice sounds a little congested or nasal. It's what we call hyponasal, meaning that there's less flow of air through the nose, which makes you sound kind of stuffy or congested. So having the deviated septum fixed often improves a patient's voice. I had a patient a couple of years ago. She was a super talented jazz singer, and she found that when she was singing, her voice quality improved dramatically after her rhinoplasty and septoplasty because she was able to breathe through her nose better. So it actually improved the quality of her singing, and she was able to hold her notes longer and those kinds of things. Better sleep quality, so patients have told me that they feel more rested when they wake up in the morning. Sometimes having a deviated septum can contribute to sleep apnea, so there are also often medical reasons to get the deviated septum fixed. I find that patients are less likely to get sinus infections because there's not as much stasis of the secretions in the nose, which can then lead to a secondary infection if you have a cold. And then the last thing is that when you have allergy symptoms, fixing a deviated septum doesn't fix the allergy symptom, but at least makes it such that you have more room inside your nose. So if you are congested during allergy season, or if you're sneezing or those kinds of things, at least the inside of your nose is more open so that it doesn't bother you as much. You don't feel completely blocked the moment your nose gets congested. So hopefully that was, I know that was a lot of information, but hopefully it was everything you wanted to know about deviated septums and septoplasties. If you have any questions, feel free to send us a message or contact our office anytime. Yeah, stay tuned. We're going to be talking more about different types of more advanced deviated septum surgeries coming up. So thanks so much. Hope you guys have a lovely holiday season.